again, in charge of the facility that is placing that order. So resources, standard order and reporting forms, requisition form, or if it is a program commodities, we know the MOH correlated number booklets that we use. So you will need bin cards as a reference of consumption to basically just know what is left for the numbers, rather to justify the order. So stationaries, calculator, if you're the digital ones, the computer, consumption registers, that is the daily activity registers, or any electronic medical records for those who don't use manual registers, and quantification worksheets. So procedure, you need to know the consumption. This is a period over which consumption is being delivery disruption. So determine total consumption, that is quantity of products dispensed to patients. This may be sourced from the daily activity registers or other records of issues to patients. Then you conduct a physical count. You need to know what you have in stock. So you conduct that physical stock. Then you determine what is the average monthly consumption. This you do by taking your total consumption divided by the consumption period. So if you've used 20 packs or 30 packs in 6 months, it's safer to use 6 or 12 months. The longer the period you use, the safer the amount, or the proper or the safer, the more accurate the amount, that's the right term. Yeah, so total consumption against total consumption period. So that will give you the average monthly consumption. So once you have the MC, in this case, we advised to use 2 years with consideration of whether commodity is established or new in the facility. So once you have the MC and you have a stock out, or you need to place your order, basically it makes everything easier. So what you do, you take the MC times period in stock. So if you want to order for 6 months, for 3 months, if you are loaded, you want to order 3 years in a go, it makes everything very easy. It is also good, it will also be a good guide if you know or you have your minimum stock at hand. You identify or you calculate your minimum stock, which we also call as a buffer stock. This is the safety stash you have in a facility to make sure you never run out. So some tend to use a month, some tend to use 2. So the preferred level of minimum stock should be based on average monthly consumptions and the time it takes to replenish the stock or lead time. So if you're ordering from your supplier, it takes a month. So at any one time, you need to have 1 month of stock and 1 month of buffer. So to allow you not to run out. So as you are consuming your actual AMC, have enough left over or enough in supply to allow the replenishment to arrive at the facility before you run out. Then you calculate the quality of medicines to procure for the procurement period, taking into account the average monthly consumption, the lead time, which is the delivery time, the minimum stock consumption period, and what you actually have at hand, which is the stock on hand. Okay. So for budgetary cost, you estimate the budget cost using the most current medicine prices. It's always good to refer to the current prices to avoid errors or using old codes or old price codes. So this procuring locally should estimate by using previous prices, which is not always safe, or conducting a market survey on prices changes for medicines, which will give you an accurate or the right cost at that moment. Then you can do a market survey. If you're doing a market survey, it should be conducted with the procurement officer and the in charge of the department, both being present. Then you prepare quantification worksheets, typically Excel sheets, which are used to aid in quantification for ease of calculations. For each commodity, you fill the Excel sheet where applicable. So that marks the end of this standard operating procedure. I hope I'm not moving too fast. I'm actually communicating. So the third SOP is how to request for health products within the facility or outside the facility. How do we actually make these requests? So this SOP will be the third. As you can see, the header, SOP for requesting for medicines and medical supplies. By a glance, you can tell this is a 3-page SOP. It shows, okay. So the purpose, to lay down the procedure for and requesting for medicines and medical supplies within the health facilities. This will serve as a guide for requesting of medicines and medical supplies. So again, the responsible person clearly has to be identified or has to be listed down. Don't mind that the pharmacists or pharmaceutical technologies appear often, because these are mostly based on pharmaceuticals, but we customize based on the departments. The content is the same, we just customize as the SOP changes departments. So accountability, again, all the pharmacists, the facility in charge and the pharmacist in charge in level 4 and 5. Basically, responsibility, accountability has to be there across all levels of care. So resources, you'll need the stock cards. And if you are using an electronic system, so the electronic database or the EMR, the daily activity registers, the order and reporting forms, the Kenya drug list, and if you're using the KEMSA to place your order, the KEMSA platform. Moving on. So procedure, you ensure that before you start, you have all the data required on consumption. This is what you need to place to generate a new order. So you must have done a physical inventory before you start the process. Once you have then you get the aggregate consumption data at the end of the reporting period. So let's say if it's at the first of the new month and you order monthly instead of, in case of program commodities, you use the previous month's data. So you must have done the physical count. Then you confirm the other option is confirm consumption to the daily electronic register, daily activity register, or the electronic dispensing records. You can consult with relevant health service providers working with the medicine or medical supplies so as to make the process inclusive and capture needs accurately. Sometimes you might have a facility has planned for an in-range, so you might have to inflate your supply. So working or networking with your colleagues will give you such information that will help you make decisions. So after that, you proceed to fill in the standard order tool. So you have a hard copy, or either if you're using a soft copy, relative to the tool at hand. So if it is ART, the family planning, malaria or TB, they have customized tool. If you're doing order for Kenya the essential drugs, and if you're using basically KEMSA, they have their own. So you just use the standard ordering tool, you fill it, and identification, the details. So if you are using KEMSA, those who have interacted with it, you know, it comes already filled with facility name and code and all that. If you're using manual, you'll actually have to put them in, write them down. So you can fill the order, facility order identification as listed, the reporting period, the first day of the month or the last day of the relative month. So if it is the last month, you write the first to the last month. So if it's program commodities, we order for the previous month or consumption already done. So you just write the date that is there. Let's say if you are now to report for August, you'll put the first and last date of August. Then ensure that you select the correct item description as you fill the form. A complete description of the item is provided. So you have to give the generic name, the dose form, if it's tablet, capsules, or injection, the strength and pack size. It is important that some products may come in different strength and pack sizes, so have to keep that in mind. Just not a matter of writing azithromycin and some come in 3, some come in whatever. So you have to keep the strength and pack sizes in mind as you consolidate this report. So you enter any received from delivery notes or invoices or bin cards or issue or requisition vouchers. Whichever amount that you received from your supplier, if you've donated, there's a way. You key all those in. Start with the beginning balance from the previous report. So the previous month's closing balance automatically becomes the current month's beginning balance. Okay? You enter the quantity you dispensed within the facility or issued from facility records, which may be either hard copy or electronics. I hope we are together. So moving on, in case you had any losses.
Yes, Doctor, we are together.
Thank you, thank you. So in case of any losses, you also have to indicate if they were defective, damaged, pilferage, or expired. Then you insert any adjustment you might have made, positive or a negative. This information is available in the bin cards or in the issue and requisition folders. Positive adjustments, let me clarify the two, the positive and negative. So positive adjustments refer to stocks borrowed from or donated by other facilities other than the primary suppliers. So negative adjustment refers to stock issued to other facilities. So whatever is an add-on is positive, whatever is a deduction becomes a negative, as related or as you can correlate. Then you enter physical stock quantities obtained during the stock counting exercise at the end of the month. You fill in dates for expiry for health commodities that are less than 6 months to expire. You have to fill this. Again, it's a key indicator of what you need to redistribute, either within the county or the county cannot consume. We also tend to reach out to the neighboring counties. So enter number of days of the drugs that have been out of stock for the last month, or simply said for the last 30 days. So in case of stock adjustments, you can adjust for stocks out if necessary to obtain consumption adjusted for stocks out using the following formula. So you do the MC multiplied by the consumption period of the period on stock. So you calculate the period in stock from the bin cards or the electronic database system you use. Also confirm from dispensing point when the stocks were depleted so as you get accurate stocks of days. So if you know that the bin card reads as of 10th of August, the commodity has been out of stock, that will also be a key guide. Then you calculate the order as follows. The adjusted monthly consumption multiplied by the sum of the lead time, which is the delivery time plus consumption period. Add that to the safe stock, then subtract the stock on hand. So basically, the number of months you have, you consider the time it takes, you add in your buffer, and you subtract what you already have at hand. So you ensure the order is completely filled by filling 0 for the items on the order that you do not need to request for. So you don't leave a blank form, you ensure you filled all the areas that have to be filled. Then you need to explain for the losses and adjustments in the comment section. At the bottom of each order document, there's a section for comments. It's proper or it's right to document that down. So the person issuing, instead of if it is in the store, knows what really happens, and also acts as a quick reference for how things happen or what really happens. So besides the other documents, once you have the losses and adjustment and you've noted down, it is also proper to write that down at the bottom of the report on the comment section as you prepare it. Then report on medicines that are obsolete in the comment section, for example, due to changing guidelines, and indicate the expiry dates and applicable. And this should be removed from the shelves. If a drug is obsolete, please just don't leave it on the shelf, remove it. Then calculating the cost. For program commodities, we don't calculate the cost. Good for us, let's play that, keeps up that way. But for anything else, there's the HPTs that you're procuring, this will be a must, and you can work through this with your procurement, or if you have the prices, feel free to go ahead. Send the validate of information. So once you've prepared the order, basically you need to validate it. So go through the details, everything you've added. You have to sign as the reporting or the requesting officer. That is including your name, designation, the phone number, and signature. You'll see all this requested for in each document right at the bottom. So you'll have to provide your details. So the approving officer, in this case, will be the pharmacist in charge or the facility in charge for level 2, should also do the same. That is, include their name, designation, telephone number, and signature. Finally, you submit the report within the specified timelines. So most of the facilities, we have to submit them within 5th. So we are sticking with the deadline by 5th of each month. If it is within a facility, you can set like a 3rd, then you collect all your reports, and by 5th should have been submitted on to the next step, which is the sub-county,